Hello, hello, hello! Welcome back to our channel. Today, we're going to tackle a more serious subject, dementia. Now, we know that talking about dementia can be a bit scary, but it's also incredibly important. You see, dementia is a term used to describe a decline in cognitive ability, which can include memory loss, confusion, and difficulty with everyday tasks. It affects millions of people worldwide, and unfortunately, there is no known cure. But here's the good news. Being aware of the warning signs can help you or a loved one get the proper care and treatment needed. And that's exactly what we're going to discuss today. The 7 major warning signs of dementia that you should be aware of. Now, we're not here to scare you or make you paranoid. We just want to make sure that you have the knowledge and tools to take care of yourself and your loved ones. And who knows, maybe by the end of this video, you'll be able to impress your friends with your newfound knowledge of dementia. So sit back, relax, and get ready to learn something new. We promise to keep it lighthearted and informative, and we hope that you'll come away feeling more empowered and informed about this important topic. Remember, we're all in this together. Let's tackle dementia head-on and make sure that we're taking care of ourselves and those around us. Thanks for tuning in, and let's get started. Memory loss. It's something we all experience from time to time. But when it comes to dementia, memory loss can be a major warning sign. Forgetting important dates or events, like a loved one's birthday or an anniversary, is one of the most common signs of dementia. It can be frustrating for both the person experiencing it and their loved ones. Another sign is asking for the same information repeatedly. Have you ever had a conversation with someone who keeps asking the same question over and over again? It can be confusing and concerning, especially if it happens frequently. And finally, relying heavily on memory aids like notes or reminders is another warning sign. While using these aids can be helpful, relying on them exclusively can indicate a deeper issue with memory and cognitive function. Difficulty with familiar tasks. Now, let's talk about the 3rd major warning sign of dementia, difficulty with familiar tasks. This can include struggling to perform everyday tasks that used to come easily, like cooking, cleaning, or getting dressed. Have you ever found yourself standing in the kitchen staring at a pot of water on the stove and forgetting what you were about to do? Or maybe you've gone to get dressed in the morning, only to realize that you're wearing 2 different shoes. Well, for people with dementia, these types of tasks can become increasingly challenging. They may forget how to follow a recipe or struggle to remember the steps of a familiar task. This can be frustrating and even dangerous, as it can lead to accidents or injuries. If you or a loved one are experiencing difficulty with familiar tasks, it's important to seek medical attention. There are therapies and treatments available that can help manage symptoms and improve quality of life. And remember, it's always okay to ask for help, whether it's from a caregiver, family member, or healthcare provider. So don't be afraid to speak up and seek support. We're all in this together, and there's no shame in needing a little extra help along the way. Poor judgment. Another warning sign of dementia is poor judgment. This means that the person may start making bad decisions or giving away large sums of money to strangers. It's important to keep an eye out for any unusual behavior related to finances, especially if the person has never exhibited such behavior before. For example, they may suddenly start making impulsive purchases or giving money to people they hardly know. They may also fall victim to scams or be more susceptible to financial exploitation. It's important to be patient and understanding with someone who is experiencing poor judgment due to dementia. It's not their fault, and it's not a reflection of their character. Instead, it's a symptom of the disease. If you notice any unusual financial behavior, it's important to talk to that person and seek professional help. Disorientation. Okay, let's talk about the 4th major warning sign of dementia, disorientation. Now, we've all had those moments where we forget where we parked our car or can't remember which aisle the cereal is in at the grocery store. But when someone with dementia gets disoriented, it's a whole different ballgame. People with dementia may get lost in familiar places, like their own neighborhood, or even their own home. They might forget how they got there or where they're trying to go. It can be incredibly frightening for both the person with dementia and the loved ones. So, if you notice that your grandpa keeps getting lost on his way to the local coffee shop, or your mom can't remember which room is hers in the house, it might be time to seek medical attention. Personality changes. We've talked about memory loss and difficulty with everyday tasks, but there's another warning sign of dementia that's just as important: personality changes. Yes, that's right. Dementia can cause a person to exhibit unusual behaviors or attitudes that are out of character. One commonplace personality change is becoming irritable or short-tempered. Have you ever known someone who used to be patient and kind, but suddenly became easily annoyed or frustrated? This could be a sign of dementia. Of course, it's normal to have bad days and get grumpy from time to time, but if this behavior is out of character and happens frequently, it's worth taking note of. Another personality change that can be a sign of dementia is paranoia. This can manifest in a few different ways. A person may become suspicious of those around them, accusing them of stealing or hiding things. They may also start to believe in conspiracy theories or feel that they are being watched or followed. Again, it's important to remember that everyone has their own quirks and idiosyncrasies, but if these behaviors are unusual and persistent, they could be a red flag. On the other end of the spectrum, some people with dementia may become apathetic or lose interest in the things they used to enjoy. This can be particularly challenging for caregivers or family members, as it can be difficult to motivate someone who no longer seems to care about anything. Apathy can also be mistaken for depression, so it's important to talk to a healthcare provider to get an accurate diagnosis. Finally, there are other unusual behaviors that can be a sign of dementia. For example, a person may start hoarding things or collecting items obsessively. They may also exhibit impulsive behaviors, such as suddenly deciding to go on a trip without any planning or preparation. As with other warning signs, it's important to pay attention to these behaviors and talk to a healthcare provider if you have any concerns. Difficulty with language. This can manifest in a few different ways, but generally involves struggling to find the right words or forgetting the meanings of common words. Imagine trying to have a conversation with someone, but every other word they say is jumbled or nonsensical. Or maybe you find yourself struggling to articulate your own thoughts, even though you know exactly what you want to say. That's the kind of experience that someone with dementia might have when they're dealing with language difficulties. But it's not just about the words themselves. It's also about how they're used in context. For example, someone with dementia might have trouble following a conversation because they can't keep track of who's saying what. They also might have trouble understanding idioms or figurative language because they take things too literally. It's important to note that occasional lapses in language ability are normal and happens to everyone. But if you or a loved one are experiencing frequent difficulties with language, it's worth getting it checked out by a medical professional. Misplacing items. The classic, "where did I put my keys" dilemma. We've all been there, right? But when it comes to dementia, misplacing items can become a much more serious issue. People with dementia may put things in unusual places and then forget where they put them. And then when they can't find what they're looking for, they may accuse others of stealing or hiding their belongings. It can be frustrating for both the person with dementia and the loved ones. Imagine searching high and low for your favorite necklace, only to have your partner or friend accuse you of taking it. It's no fun for anyone involved. But there are ways to manage this behavior. One strategy is to create designated spots for important items like keys, wallets, and phones. You can also label drawers and cabinets so that it's easier to remember where things go. Another tip is to try to remain calm and patient when dealing with accusations of theft. Remember that it's not the person's fault. It's the disease that's causing this behavior. Try to redirect their attention to something else, like a favorite activity or a memory from the past. It's important to remember that misplacing items is just one of the warning signs of dementia, and it's not always a cause for alarm. And there you have it, folks, the 7 major warning signs of dementia. We hope that you found this video informative and helpful, and that you now have a better understanding of what to look out for when it comes to this important topic. Remember, if you or someone you know is experiencing any of these warning signs, it's crucial to seek medical attention. there are treatments and therapies available that can help manage symptoms and improve quality of life. Don't be afraid to ask for help. Now, before we wrap up, we have a quick request. If you enjoyed this video and found it helpful, please give it a like and consider subscribing to our channel. By doing so, you'll be helping us create more informative and engaging content just like this. Thanks for watching, and don't forget to take care of yourselves and each other.